COVID-19. Infection Prevention and Control. Part 2. Control Measures. Early recognition and reporting of cases. Encourage healthcare workers to have a high level of clinical suspicion. Institute screening questionnaire. Post signage in public areas reminding symptomatic patients to alert healthcare workers. Promotion of respiratory hygiene is an important preventative measure. Suspected nCoV patients should be placed in an area separate from other patients, and additional precautions promptly implemented. Plan staff surveillance based on respiratory symptoms before every shift and quarantine if needed. Follow social distancing. Infection control practice or PPE usage training for all relevant workforce. Early assessment or triaging of cases. Categorize patients based on severity, Category A mild symptoms, Category B moderate symptoms, and Category C severe symptoms. Plan how to triage all patients with epidemic symptoms without coming in contact with the general pool of patients. Those who need a resuscitation need to be transported to a resuscitation area, intubated with minimal droplet expulsion and then shift or admit. Plan how to transport safely outside the ICU in case of need. Overall, avoid all types of transport or avoid CT-like investigation, more point-of-care tests. There should be an exclusive good transporting system and bed management system for inter-hospital transport. Plan for shifting out and discharge as per national or state guidelines. Proper signage shall be displayed in all patient areas to reduce confusion among the patient and staff as well prevention of transmission of infection. Institutional SOP for the following activities should be developed. Administrative controls. List out the human resource available in the hospital with their name and designation under different categories. Keep their contact details ready. Identify and categorize required human resources into various categories: doctors, nurses, pharmacists, biomedical engineering, lab, ICU technicians, X-ray technicians, security, laundry, housekeeping, etc. Appropriate placement of hospitalized patients promoting an adequate patient-to-staff ratio. Accommodation facility for isolation duty staff should be arranged within the hospital premises for avoiding daily traveling. Establishment of sustainable infection prevention committee infrastructures and activities. Healthcare workers training. Patients' caregivers education. Policies on early recognition of acute respiratory infection potentially due to nCoV. Prevention of overcrowding especially in the emergency department. Provision of dedicated waiting areas for symptomatic patients. Make a system in each center to communicate with the workforce, patients, family, other healthcare institutions and government institution, as per the need and situation. Make a system how to collect this information from the treating group and patient care areas. Planning and management of telemedicine. General public has many points of reach into the healthcare system for consultation, follow-up, other services from a doctor, palliative care nurses and any other healthcare personnel. Proper reporting and grievance redressal. Environmental and engineering controls. Plan how to ensure continuous power source and alternate power sources. Ensure continuous oxygen supply or medical gas supply. Ensure working status of equipment daily. Identify serious maintenance problems and rank them in order of maintenance. Plan for corrective and preventive maintenance. Spatial separation of at least 1 meter distance should be maintained between each suspect patient and others. Duration of contact and droplet precautions for nCoV infection. Standard precautions should be applied at all times. Additional contact and droplet precautions should continue until the patient is asymptomatic. Collection and handling of laboratory specimens from patients with suspected nCoV. Healthcare workers who collect or transport clinical specimens should adhere rigorously to standard precautions to minimize the possibility of exposure to pathogens. Ensure that all personnel who transport specimens are trained in safe handling practices and spill decontamination procedures. Describe how to provide external technical service if necessary. Infection prevention practice or PPE training. The hospital can be divided into zones for efficient patient management and infection control. Try to have a floor plan by identifying all utility areas, corridors, stairs, etc. and mark the same in the floor plan. Housekeeping or infection control is in charge of disinfecting the route, trolley etc. after shift. Thank you for patient listening.